nurse. If it is determined that further screening is necessary, there will be assigned a patient number and an appointment for the collection site. We'll do a walkthrough, so I'm not going to discuss it because we're going to bring you through it. But we ask that you do not just show up. You will be turned away. So please call the 550 number, 550-2536, so that you do get that patient ID number and you can come through the site. And I'm going to go ahead and turn it over to Judge McDaniel.
Thank you, Mike. I want to thank y'all again as well for being here today. I also want to thank the county judges and all the elected officials from the 5 counties who have agreed to merge together to have one regional emergency operations center for this event. As everyone knows, the supplies for testing, including PPE and things such as that, are low, and we felt like this was the best approach to serve our citizens, as well as our first responders and all of our emergency medical personnel. We do have enough test kits to run this station for a couple of days with the promise of more coming. And as Mike said, please call the phone number. It's very important that you go through the screening process by phone. Do not show up here to be tested. You will be turned away if you do not have the tracking number and the scheduled date and time to be here to be tested. At this time, I'll turn it over to this nice young lady right here. After we go through the process here, we'll return here for questions at that time. Thank you.
Hi, I'm Judith Smith, Director of Health for the City of Port Arthur, Jefferson County. We want to just inform the patients as they come for services, what will occur. We will be performing a nasopharyngeal test. So when they actually come, they will have the swab inserted into the nostril, halfway between the entrance of the nose and the ear. And so it's going to be, we'll actually apply a little pressure and enough to get any of the mucus of the nose. And after that, we will be placing it into a media for transport. The actual test does not hurt, but it may be just a little bit uncomfortable. So we just really want to, the patients to know what type of procedure will go forward as they come up. Thank you.
Mike, you want to go through the process and we'll do Q&A?
Are we ready for them to come through? Okay. We'll just.
Okay. Were y'all able to hear any of that? Were you having? Sorry.
Are you guys okay with doing question and answer inside when it's like not as hot?
Appreciate y'all because it's windy.
Hi, how are y'all? We're about to start our process, which should be very smooth, very easy, and we start the morning at 8 o'clock. For those of you that don't know me, I'm Latasha Mayon, Assistant Health Director, City of Port Arthur. We're actually going to have 3 stations already set up in the morning. Station 1 will be the first checkpoint. At that checkpoint, the police officer will have a list and a specific number for each patient that have been pre-scheduled to come in for testing. Unless you are scheduled through the helpline, you will not be tested here at this site and you will be turned away. So at station number 1, you will need to have your identification and you will need to have that unique number that you were given during your appointment time. Once the police officer checks off everything that they need to at that time, he'll direct you to station number 2. It's extremely windy out here. At station 2, this is actually the triage. So we will get your identification, we will check your temperature, in addition to asking some additional health questions. Once you finish at station 2, we will go over to station 3. Now, we will have signage actually on tomorrow, so you'll know exactly what's expected of you at each station, okay? At Station 3, this is actually the test station. You will have a practitioner to go around to either side of the car, whoever's going to be tested. That practitioner will explain the procedure to you, the amount of time that it's going to take for testing. They will collect the sample, and once that's done and you get your discharge instructions, so far as for what you need to do until your test results come back, you will exit the 3 stations. So be prepared to stop at each station. Make sure you have your identification with you. And if you have any insurance information, make sure you have that also. And that important number that you get at the time that you set your appointments. Again, you will not be screened unless you go through the call center prior to arriving here. People without appointments will be turned away.
And again, 8 a.m. tomorrow.
8 a.m. tomorrow is when the testing will start, according to appointments. I just really want to make that clear. According to appointments.
Can you explain steps 2 and 3? Or just run through steps 2 and 3?
I will be glad to. So, Station 2 is actually the triage station. There, we will ask for your identification. We will ask for your unique number that you were given at time of appointment scheduling. We will check your temperature, and we will ask additional health questions.
What are those?
The routine things that we have been asking so far as, have you been coughing, have you been running a temperature, have you been having respiratory issues, maybe some respiratory distress, have you passed out at any time, nausea, vomiting, diarrhea, abdominal pain, all of the criteria.
And Latasha, obviously you have professionals here, but it can be pretty intrusive for anyone. But just in case there is a child that's screened and brought in there, will there be extra care? Because obviously this is a very
much so. We will have actually at any time out here for the testing procedure, we're going to have some non-clinical people, but we plan on having at least 6 practitioners out here for each test day, a minimum of 6. Most likely it's going to be greater than that.
She explained number 2, number 3.
Number 2, I just went over.
Oh yeah, you did. Number 3.
Okay, so at number 3, this is actually the test station. You will have a practitioner that will come over to your car, will explain the testing procedure to you. Make sure you voice understanding of what's about to be done. Once that is done and you understand, then the practitioner will give the sample. The sample is a nasal sample. The sample takes about 3 seconds in order to do. Once we finish with the sample, it will be sealed. The patient's identification and everything will already be in a biohazard bag that goes along with the test, and that will actually be put on ice. All the samples will be picked up daily.
Well, Latasha, on a personal note, and all the nurses and physicians out here, y'all are on the front line. How does it feel for y'all? Do y'all feel fear? Do you feel you're adequately supplied with what y'all need to do the work? Just your thoughts on a personal level going through this.
I can only speak for our counties here. At this point, we have the supplies that we need to perform the tests that we need to do here. We have all of our PPE equipment that's needed for us here at our particular test site. A lot of the other areas, they don't have everything they need. But we pulled so many counties and pulled our resources together that I feel comfortable.
What resources are those at this time?
We pulled so far as for equipment. We got all of our judges together. We made all of our decisions together as a whole. So everyone from our county should say the same thing. Everyone is going to be treated equally, and we're going to do the best job we can for our counties.
Do you know how many test kits are available right now?
Not at this point. I know we're going to be testing between 20 and 25 per day, and we'll go from there.
And you're still expecting more?
We are.
All right, that's going to conclude the walkthrough part. If everybody will give us about 2 or 3 minutes and get set up inside, we're going to go right inside the first room on the right, and we'll do Q&A right inside, okay? Thank y'all very much.
Thank y'all. You're welcome.
Thank you. I love it.
got a much better radio voice than I have. Photographic press
It's pretty cool.
Are we good?
Aaron,
We need the media to separate just a little bit. Everybody ready? All right, so you've seen the process here today at our testing site. This is a plan that we've been working on for a couple of days. This will serve the regional effort that we have very well. There will be some bugs that we'll work out as they come up, but we're ready for those. And at this time, I will take any questions.
Judge has mentioned over and over again the importance that you must call that number before you come out here. Explain that.
Yes, sir. They're being screened. People are being screened by nurses to make sure that they meet the criteria to be tested. Again, we have a precious few number of those test kits, and we're making sure that people meet that screening process to be tested when they get here. If they have not received the tracking number and the appointment time, they're going to be sent away. And I know that's going to make somebody mad, but we've got to go by the process that's been put in place.
Judge, yeah, I just wanted to know as far as if you have part of this Newton and Jasper County, Tyler's also, I know y'all been talking to Tyler County, but are you concerned if you are not feeling well and you're sick? I can't even imagine having to make that drive to Jefferson County to getting tested. So
Right.
what's your message to those folks, and will those folks' needs be addressed? Because it's a long drive.
There are plans in place to open some other sites as we receive more PPE and test kits. I'm not ready to say exactly where those will be just yet, because we're also going to be going by the number of cases that we're getting to determine where the next site gets open. But we have those places identified. I feel for anyone that has to drive from northern Newton or Jasper County all the way here to mid Jefferson County. But that is the plan at this time. If they have an option where they can go locally to be tested, that's certainly fine. With the resources that we have right now, this is what we're prepared to do.
How many days will this be open? I mean, is this tomorrow only? How long will this schedule?
We'll be operating 8 to 5, Monday through Friday, I believe. Is that correct? 8 to 5, Monday through Friday until further notice. Now, if we get a plethora of test kits and a plethora of all the other PPE that we need, and we need to open longer, we will. But we want to get those other sites established before we start running extra hours at any location.
What was the reasoning to open a second site in Jefferson County before the other counties?
This is the first site.
The other was a lab,
Okay.
It was just private labs that were being used, not actual
They agreed to let
drive-through
us,
test sites.
so they agreed to let us send our people there, and that's what we have been doing.
I just want to ask Mayor Bartier, maybe I need to correct this, but is there, does Port Arthur Health Department still not have test kits of their own where people, especially who live in like in Southern Port Arthur, can just go to the,
I'd like to make Ms. Julie Smith, because she said she doesn't.
does not, okay.
Right, she doesn't.
And I know all of y'all, and Davlin addressed this earlier, but there's a lot of talk in the community, and I know Judge Gauthier, you experienced this weekend. There are elected officials, that we're hearing about that, for instance, there was a gathering where an elected official in Orange County had a gathering Saturday, and we got bombarded with citizens naturally concerned because y'all are preaching. In fact, that JP posted on her thing not to gather, yet she had a big gathering. I know Davlin addressed it, but now if we could address it, there's concern about Judge Brannick made a posting as well about him showing up at the emergency room. And there's been a lot of people concerned because y'all are preaching one thing, our elected officials leading by example, and I'll let y'all both address
Sure.
those incidents.
I'll start off with Judge Brannick, because I should have already said that, but Judge Brannick sure wishes he could be here today. He is feeling just fine, but he is setting the example. So he feels like he has a possible exposure to COVID, and he has decided to self-quarantine himself or self-isolate. I'll tell you that I just learned about an hour before you arrived today that Judge Weeks in Newton County has done the same. So we have 2 county judges that have decided to self-isolate for whatever reason, and I support them in that effort, and they are trying to set the example. I'll tell you, Angel, a week and a half ago, I thought the same thing, that maybe we were okay to continue living life as normal, but I don't think that way anymore. And I would imagine that Judge Gauthier would, if he wants to address the question you asked him, that's just the way it is. Everybody thinks that, even when we walked in here, we all almost walked in here together. It's just normal life, but we've got to adjust that. And we're asking everybody to do that, and we're trying to set the example. Do you have anything you want to say?
Well, I would just like to add on that, just because whenever we found out about that particular incident in Bridge City, I made a phone call to the JP and talked to her personally. Our sheriff's department had paid a visit out there also, and we asked them to disperse just like we would anybody else, and they did that. At the time, it was more of she said it was a misunderstanding of the language that we had in the order. I cleared some of that up in my new order today, just to make it more clear, about what a facility is, which a private facility is anything, any place, if you look up the definition. And what we've tried to do is make sure that we all are, as elected officials as well, following those same guidelines. But it is kind of easy sometimes to kind of, think that you're not that you're above it, because they're not, and she certainly didn't think she was. She thought she was doing the right thing, and as soon as we informed her differently, she dispersed, at that point. And so, I think there's more of a clarification and more of an understanding of that order now because of that, and sometimes that's what it kind of takes to get us to that point. But, I think everybody is understanding that what we have to do is maintain social distancing in any instance, at any location, any place, anywhere now, and that's what we have to do.
Thank you, Judge. And I know, Mike, we noticed today, the courthouse, you are doing temperature testing before going in.
We're doing a full vitals check.
Well, there was a big line of them packed close together going into that entrance. Is that a concern? And again, if you could address Davlin, address the situation with the county judge's wife going to the emergency room.
So I'll address the county judge's wife first. She was in, the guidance that's been put out was, if you're having any sort of acute respiratory problems or anything like that, you call ahead to the emergency room and make that appointment to be seen. That's exactly the protocol they followed. There was not any sort of abuse of power or anything like that.
And about the courthouse, will that be changed?
Yes, we're trying to put our processes in place. So yes, that will be fixed. That's a pretty easy fix, I think.
Okay, I'm confused. Was Brannick's wife experiencing acute symptoms, or was she not?
She was.
We've been told 2 different things.
No?
Yeah.
Okay, my mistake. I don't get it.
I talked to Judge Brannick yesterday. She was not experiencing acute symptoms, but because Judge Brannick is part of the EOC and deals with so many people, he was requested to bring her in so that she could be tested just to rule it out. The results are not back yet. He has not been tested yet. If her results come back positive, they will both be tested, or he will be tested. But he's going to self-quarantine until those results come back.
And I think a lot of folks, especially the Chambers County sent out the other day a news release that kind of explained the transmission and like how was it transmitted, the age of the person, maybe a location. Can we get, I know we don't want to invade people's privacy, but without identifying those people, can we at least know more information? Like for instance, Mayor, you have a case where it was a clinic. So obviously there are people wondering, if I went to that clinic, if I've been exposed. It seems like right now, if we know basically if it's through community spreading, if that's the case that's going on with these cases in our area.
Okay, and there's been some concerns about that. I'm going to speak about it because I've been tasked with researching and trying to help everyone understand. We want to be as transparent as possible, but there are also laws we have to adhere to. The health and safety codes are what we follow. We've been posting those and trying to explain to people there are things set in place to protect confidentiality, HIPAA laws, things like that, but we are also concerned with people who may have been exposed. So our public health departments are the ones tasked with running the investigation. They go in, they do the questioning, they do the investigation, and they find out who they've been around, who has a chance of being highly susceptible to having an exposure situation, and those people are notified by the health departments. Those protocols have to remain in place because we don't want to turn this into more of like a vigilante research type of situation. We start giving out much information, then our health departments are in trouble for violating those confidentiality rules that are set in place, that are laws. So I challenge you to please look at the health and safety code that we've posted and see what those laws entail. And you know, our elected officials and our medical staffing, they have to go by those protocols and rules too. And I get the questions every day, well, this area is doing this and this state's doing that. Well, we're going to take care of our area, we're going to take care of our citizens, we're going to do things the way that they are set up legally to be done, and we're going to do the best we can to make sure that we are taking care of our citizens and informing people. So we want you to follow those rules and things that have been set in place and go from there.
Speaking specifically about the Beaumont Port Arthur case, it specifically says 18 people, patients, came through this person, and then any medical professionals. How is that, according to the city of Beaumont's news release, still like a minimum fear of community spread? That's more than a dozen people.
Okay, well, depending on who released that or where they got that from, you know, I can't confirm that. That's handled through our public health department. They have gone, they have checked out what type of exposure there was, who was actually exposed in that proximity. There's a lot of things that have to be ruled out. Just because they may have 18 patients or however many, you still have to find out where they were, when they were there, who was there, who they were actually around. So those are all things that we have trained people that do those investigations, and we're working daily to make sure we minimize people that are exposed.
So at this point, do we know if these cases are community spread or were these folks who traveled?
I just issued a press release. We are up to number 6 in the city of Beaumont, and 4 of them are travel related.
How does the investigation timeline work? If the minute we're announcing the case, we already say there's little fear for community spread, has much of the investigation already been done? How does that work?
Depending on where you're getting your information, if you're getting it from a press release that is coming from the health department, then the investigation has been done. We have worked on it. People have been notified to quarantine or self-quarantine, or been notified that there's a possibility that they've been exposed. Now, that doesn't mean everyone shouldn't take precautions. We just sometimes don't know who you've been around, when you've been around them. We're not going to presume that everyone, by telling them you're not at risk of catching this, we can't step out there and tell you you're not at that risk. That's why we're asking you, wash your hands, take precautions, social distancing, you know, and it's a hard thing to do. We're used to being around a lot of people, so we're having to learn how to adjust our lifestyles so that we keep everyone safe.
for example, in the Beaumont Port Arthur situation, is just the Beaumont and Port Arthur Health Departments that are conducting the investigation? Are there any other, I guess, entities that are conducting the investigation?
It's the health department designees, people that are trained and designated by the health department because they are the lead in this case. And I think that's what's confusing for so many people. We're so used to this area of dealing with weather events like hurricanes, storms. So you have different people in control of what's going on. In this, it is a health event. So by law, your public health departments, they're the ones handling this, controlling it, and they are the designees that are appointing people that are handling those investigations.
And Mayor or Ms. Smith, what is your message to the folks in Port Arthur? I know just online there was a lot of concern because of this clinic does see a lot of folks. So what do you want to tell your citizens tonight who might be concerned about the situation in Port Arthur?
She said, and even what Ms. Smith has said, is that we just continue to be vigilant, do what's necessary, maybe try to dispel all the myths that are coming from all these different areas and about certain things, and social distancing, not gatherings over 10, no matter if it's a funeral, a wedding, a bar mitzvah, whatever, only 10 persons. Some faith worship centers are trying to have more than 10 persons in a room. It didn't say what a certain square footage is, just 10 persons. And if we would do those things, we would probably lessen our chances of being infected. Am I correct on that? Yeah.
Hey, Judge?
Yes, sir.
How coordinated are these judges' proclamations between the different counties? Are they a coordinated effort, or are they each one separate on their own?
For the most part, they're coordinated, but you know, we have different conditions in each of our counties or communities, so there are some tailor-made items that we put in there for each of our counties. But I can tell you that your 5 and actually probably about 8 county judges talk to each other daily, sometimes even 2 or 3 or 4 o'clock in the morning, and we are together on this, and I'm very proud of that. In fact, something else I want to talk about is future press releases. You won't get any more from me at midnight anymore. We're going to have those releases each day through Davil and Walston. It'll be a coordinated effort through the 5 county coalition that we put together, and those will come out each afternoon at 3.
And Judge, just to reemphasize, you are hopeful to have test sites closer to Jasper, Newton, Tyler in the near future?
Yes, sir. Yes, sir. Absolutely. As soon as we can.
As we get more confirmed cases as a part of those coordinated releases, will it tell us how many cases, like a running tally?
As Carol alluded to, there's certain information we can and cannot release, so Davelin is up to speed on what those HIPAA laws are and what have you, and as she compiles that information from the health departments, they'll have a deadline each day to get that to her by noon so she can get it out by 3. And whatever we're allowed to release, we're going to release it.
Okay, so numbers?
A number of what?
Number of cases, just the number.
I know that you have yours.
I can speak to Beaumont.
Sure.
I can speak to 6 for Beaumont.
I was just clarifying to make sure that that was something that could be included in this daily release.
2 for Hardin County, 1 in Lumberton, 1 in Sylvan.
What about Jasper County?
0 active cases at this time.
Can you check that goes for Tyler as well? Tyler, Newton?
When I talked to the EMC on my way down here, he expressed that they had no active cases at this time. Neither did we.
Just go ahead and hit a 1.
We have 1 active case at this time, and I think that we are going to make an effort to make sure that we roll those numbers up every day so that she can put those in her press release. So we'll at least have a number of tests and possible tests, and then if there's any positive outcomes of those, we'll make sure we roll that up.
So to be clear, for all of Jefferson County 6, would it be? For all of Jefferson County?
Jefferson, yeah, there's none in the we're at 6.
6, okay.
Sure, go ahead, Carol.
Okay, real quick, hadn't had a chance because I was working on the press release on the 6th. We have, for those of you who remember the southeasttexasinfo.org site we used to have, we brought that site down. It wasn't real user-friendly, and we've been revamping it. I'm going to pass this out, and I'm about to shoot a press release from Sabine Nature's Chiefs Association. I'm sorry, I can speak today. Anyway, so the Sabine Nature's Chiefs Association is rolling out setinfo.org, and it is going to be a one-stop shop for information for all of Hardin, Jefferson, and Orange counties. We ask that you go online, check out the site, see how user-friendly it is. You click on your area, what you want to know, whether it be what's going on with your educational facilities, what's going on with weather, your medical locations. We are still adding sites. We're updating logos, making sure a lot of those sites are official sites. But for now, it is up and running. The emergency management information, city government information, and a lot of your law enforcement stuff is pretty much up to date. So if you'll play around with those sites, each day you'll be able to see, without trying to dig around and find all these different locations, what is being released by all the different entities in Jefferson, Hardin, and Orange counties. I'll give you a copy of this and I'll shoot that information out to you.
So that'll be up until
It's
further
up.
notice?
It's up, yes. It's not going down. That's, unless it crashes or something, it's not going down.
Anything else?
All right, thank you all so much.
If Carol, could you stay, let's talk to the media real quick before they leave. Talk to the record.
Great tomorrow.
Thank you, sir.
It was in print and color, so I'll get it for you guys. Right there. I thought I had no flyers and stuff.
Stick around for a second. Like 2 minutes.
I can't see.